morning, and you may be seated. Where do I start?
Morning,
Okay,
Justice.
Costa, is that you? Good morning.
Justice, we will call Nompilu Nkosi. She will testify in English. If it doesn't work, she might change to isiZulu. Her affidavit is LR 91,
Thank you.
and she will take the oath.
Good morning to you.
Good morning, Justice.
Good morning. Would you put your full names on record, please?
My name is Nompilo Nkosi.
Ms. Nkosi, do you swear that the evidence you're about to give will be the truth and nothing but the truth?
I
And
do.
if so, raise your right hand and say, "So help me God."
So help me God.
Very well. Advocate Krause.
Thank you, Justice. Ms. Nkosi, your brother Sizwe is a mental health care user, is that right?
Yes.
Please tell us about him. What is the problem?
Sizwe was diagnosed autistic. He's autistic.
And what does that mean in relation to his functioning? Can he speak?
When it's necessary, he can speak one word.
And can he walk?
He can walk. He can go to the bathroom. He cannot read. He does not go to school. He cannot write.
And something that is dear to you and in knowing whether he's happy, what does he do when he's happy?
He hums when he's happy.
He does what?
He hums.
Oh.
Yes.
He can't sing, but he hums.
Yes.
Now, where does he fit into your family?
Sizwe is the middle child. He's my brother.
And you, the older sister?
Yes, I am.
Is there any other siblings?
We have a younger sister, Xoliswa Nkosi.
Is your mother and father still alive?
My father passed away. My mother is still alive.
Is your mother present here?
No, my mother's not present
Not
today.
here. Okay.
Now, Sizwe was institutionalized at a fairly young age, is that right?
Yes, that is right.
When was he institutionalized?
When he was 11 years old.
And that was in 1996, is that right?
It was in 1997.
Okay. And where was he institutionalized?
He was institutionalized at Waverley Care Center in Germiston.
And that's a Life Esidimeni center.
Yes, it is.
He was there for quite a long time.
Yes, he was.
How did you, as a family, feel towards the care that he received at Life Esidimeni Waverley?
We were very happy with the care that he received there.
Was he well cared for?
He was well cared for.
Was he humming?
He was humming.
Now, you heard about the closure, of the possible closure. When was this?
It was around August in 2015.
And what was your first reaction to that?
Fear. We were scared
And why were you scared?
because we didn't know what was to come, what was to be expected after the closure.
You were also scared to take Sizwe home, isn't that so?
Yes, we were.
Please tell the court why is that? What would happen when he is at home?
Sizwe sometimes gets violent in such a way that he throws things to the neighbor's house, breaks things. He becomes pretty much violent. And he jumps, then he runs away. So we're afraid for his life as well, because when one runs away, you don't know where they'll end up.
Yes, you're afraid for his safety.
Yes.
Now, you were afraid. Did you do anything about this when you heard about it in August?
Yes, I did. I wrote a letter to the president's office.
Can you tell us when you wrote that letter?
I started writing letters around about October.
Could you please go
Which
to...
presidents?
Our
There are
president,
many presidents in this country.
we have
Rugby clubs and soccer clubs.
You mean number one?
the president of the state.
Okay.
Would you please go to LR 92 in front of you? You see that letter?
Yes, I do.
And it's a letter to, on the face of it, the President of South Africa, and it's dated 4 November 2015. Is that the first letter that you've written?
No, it's not.
You've written a letter before that date to the President,
Yes, I did.
but you don't have a copy of that letter, is that right?
Yes, correct.
Now, in this letter, did it ever bounce back to you?
This one didn't bounce back.
Yes. In the first paragraph, you complain about residents in the hospital losing their home and 700 employees losing their source of income.
Correct.
Was that a concern that you had at the time?
Yes, it was.
And did you receive any notice back on that letter?
No, I did not.
Now, at a later stage, you again sent an email to the President.
Yes, I did.
And your indication was you were planning something. What was that?
We were planning a march on the 9th of December.
To the President's office.
Yes.
And as a result of this email that you've sent, what happened?
I received a call from the president's office stating that we cannot come to the march because
Ye-
there's protocol to be followed.
Okay. So that email was definitely received by the President's office.
Yes.
Okay. Can I just, just to follow the timeline, there is, you did other things as well, isn't that so, to get attention?
Yes, I did.
What did you do?
I organized a march for the 16th of February 2016.
Yes?
I
Tell us
also-
about that march.
Well,
Let me take you to LR 93.
yes.
Were you the organizer of the march?
Yes, I was the convener of the march.
Did you have to pay to get the march registered?
Yes.
And you convened it? You
And
convened the march?
What do you mean
Yes,
to
I
pay to
convened the
register?
Can you tell the Honourable Justice how much did you have to pay?
We had to pay 152.12 cents
To whom?
to the JMPD. That's where we registered the march.
And the document in front of you, it's a memorandum.
If you don't pay, wouldn't you be able to march?
According to my knowledge, yes.
Okay.
The document in front of you, LR 93, that is the memorandum that was handed over at the march. Is that right?
That is right.
Let us just look at the document. You state in the second sentence that the Department of Health is threatening the well-being, rights and lives of your loved ones and that you are speaking and marching on their behalf. Is that the reason for the march?
Yes, it was.
You also, in the third paragraph, complain about not being consulted. Is that right?
That is right.
And you also complain that a relocation can't happen on the 31st of March 2016. And the reason for that was?
It was too short notice, and we didn't know how our loved ones were going to be prepared. We were scared for them.
Yes. Now, at the bottom of this document, LR 93, there's place for signatures, but this document does not have any signatures. Is that because the original was handed in?
Yes, the original was handed in.
Okay, and who signed the document on behalf of the department?
It was the former MEC, Ms. Qedani Mahlangu.
Explain to the court how that happened, because it says head of the department, Dr. Barney Selebanu, at the bottom of that letter. Could you explain how that happened?
We submitted the memorandum. She noticed that it wasn't her name at the bottom, and
Just a moment. The she that you're referring to is?
the former MEC.
So
Ms.
she
Qedani
accepted the memorandum.
And she refused, Ms. Qedani Mahlangu refused to sign the memorandum, saying that this was not her name, and we requested that she cancels the name and sign.
Did you ask her
Yes, I
to
did.
cancel the name and sign?
Where was this? To where did you march? Which
To the
building?
To the Department of Health in Johannesburg.
And she was there in person,
Yes, she was.
and she came up to what? You went up to your foyer or her office, or where did you make contact with her?
She came outside of, she came to the foyer, then she came outside of the building.
With bodyguards, naturally.
With her colleagues, I would say. I didn't recognize any
Yeah.
bodyguards.
Okay. So she came out of the building, and how many were you, do you think? I mean, the marchers, what's your estimate?
Not over 30.
And when she saw that the memorandum, LR 93, did not bear her name, she said, I'm not signing, this is not my name.
Yes, Justice.
And what did you do or
I-
say?
I told her that this document was written by us, so it can be amended at any time. So could she kindly cancel the name and write her name and sign?
And did she amend the one you gave her
Yes, she did, Justice.
and signed?
Yes.
Where's the signed copy?
We handed,
Did she sign, give it to you, or did she sign and take it away?
she signed her copy and she signed my copy. Then we gave my copy to Section 27 for safekeeping.
Okay. Counsel?
Thank you, Justice. After the march, you received a document, LR 96, from Dr. Selebanu.
Counsel, I must have stepped through the evidence. I don't remember in what form did the response from the presidency come.
Maybe I could just go back there. Thank you, Justice.
Please do.
When you sent an email to the president, we're just going back way bit, you were phoned by Portia.
I sent an email to Portia, seeing the president's office, stating that we were coming to the offices for the march. Then a gentleman, I cannot recall his name at this point, called me back and told me that we cannot come to the presidential office to march there because there's protocol to be followed.
Did he phone you?
He phoned me, yes.
He didn't write an email back, no.
No, he called me, a phone call, sir.
No.
And did you ever receive any formal reply on your complaint from the president's office?
Not that I can recall, no.
Now, the contents of the email would be Ella 92, would it be? The one of November the 4th.
That is one of the emails, Justice. Yes.
It's the second of the two.
Yes.
Thank you. I understand now. You may proceed. Counsel.
Thank you, Justice. Ms. Nkosi, please turn to LR 96.
I now complained about the weak aircon yesterday, and somebody made sure that I'd never complain again. It's blowing quite strongly. I don't mind can we reduce the fan? Whatever you put there gets blown away. Or is it you working?
Okay. Ms. Nkosi.
Sorry for the interruption. Please proceed, Counsel.
Thank you, Justice Musaneke. LR 96 is a letter signed on the 11th of March 2016. It got Dr. Selebano's name, but it's signed by Mr. Musanochi. Do you see that?
Yes, I do.
And that is in response to the march in that you had. Is that right?
That is right.
Now, the bottom line to this response is that the department is saying that they are engaging the family and they're acting in terms of the policy.
I'm sorry, let's describe LR 96 a little fuller, Counsel.
Thank you.
What is it?
Thank you, Justice. Would you agree with me that it is a response on the Life Esidimeni Termination March Memorandum? That's the previous document that we referred to.
Yes, I do agree.
And just at the bottom of the last page, do you see the date there? Could you read the date?
The 11th of March 2016.
And in whose name is the letter?
Dr. T.E. Selebano.
And who signed the letter?
Dr. Selebano.
No, I'm not sure. It says PP there, and it says Mosenoche. Do you see that?
Yes, Mosenoche, yes.
Yes. Now, this was in response to your march. Do you agree?
I do.
And the content of this letter basically, I think if one reads it carefully, states that the department is engaging the family and that they're acting in the best interest of the mental health care users. Did you think that they were doing that?
No, I do not.
And why is that?
Because there are certain things that we would find out via the grapevine and others through the media. They did move patients before the end of the 31st, actually before the end of the 31st of March, and they were not communicating with us.
Yes. If one go to the conclusion at paragraph 5 on the last page, page 4 of that letter, do you see it?
Yes, I do.
There's some grammar mistakes, but I'm going to read it to you. It is our wish that the families understand and note the extension in a positive manner as proof that the department intends to place the mental health care users to a well-renovated NGOs and other hospitals. Did you believe that?
No, I did not.
And could you tell us why?
Because Waverley and an NGO, the nature of an NGO does not give the same level of care. The structure on its own was not equivalent of what they used to live in at Waverley. So that on its own is not true.
Yes.
Proof that it was not true.
Now, eventually, it was said that your brother Siswe was going to be moved on the 11th of May 2016.
Just before you leave the letter claims a number of other things. Look at page 2 under the title discussion. You see the middle of there's a recordal of your demands. You can see that. On page 2, after the subtitle discussion, the relatives concerned organized a march, you can see that, to the department and handed over a memorandum with 2 main demands as follows. Then it's recorded that the memorandum was received by the MEC for Health, which you've already told us. Then the department responds. The department consults them and develops a plan that ensure ones will be cared for. I'm sorry, let me see. Yeah, firstly, they say they engaged you with a view to developing a plan and in connection with the project progress. Did that happen?
I'm not aware of it, Justice.
And then it comes that they say that in bold letters you can see that the department admit it is not prepared, not ready to close life as it demands in a lawful and humane manner by 31st March. That they conceded, isn't it, ultimately?
Yes, they did.
Then you go over under 4. Then they really set out the department's position. Starts with the policy. You did have discussions with them about the policy, did you? The new policy that they say they would like to implement.
Not that I'm aware of, Justice.
And then they say in the letter to you, the department is under severe financial constraints and the importance of complying with Auditor General cannot be undermined. What was that? Did they tell you any more than that?
No, not that I know of. They did tell us that they were closing the institution because of finances. Other than that, no.
And then they say that the new priority is to take all chronic users to care either at NGOs, both day and residential, and they must collect treatment from community clinics. Did they make that clear to you? That that was the plan?
No, they did not, Justice.
But did the letter reach you in any event, this letter?
Yes, it did reach us, the letter, Justice, it did, yes.
I was just doing that we're still searching up to this day why they shut down Life Esidimeni. And you have been very closely connected with the struggle to resist this.
Yes, Justice, I have.
So I was, at some point, think about it, I'm going to want you to give me your impressions of why they shut down Life Esidimeni. You must have views by now. You must have gathered whatever to come to some conclusion. I won't interrupt your counsel now. Let her continue. But I'd like us to have that debate at the end. What do you make of all this? Counsel, you may proceed, please.
Thank you, Justice. Mr. Nkosi, if you can please turn to LR 23, LR 23.
What's the problem? Is it not?
Will we go back to the bundle that you now have, just now?
Thank you.
Now, after the first move, Siswe was moved away from Waverley. Is that right?
That is right.
LR 23 is a photograph of Siswe.
Yes, it is.
When was it taken?
It was taken before he left Waverley, around about March 2015.
And who took the photograph?
My sister did.
And how did you get this photograph?
I asked it from my sister.
And the photograph shows a young man with a smile.
Yes.
Yes.
Amazinyo aphelele phi, mama? Now just asking the witness what happened to his teeth in isiZulu.
Well, he lost most of his teeth.
Yes. You got a call on the 11th of May 2016 that they were going to move him. He ultimately wasn't moved on that day. But did you go to Waverley on the 11th of May?
We did go to Waverley on the 11th of May.
And what did you find there?
We actually found that Dr. Manamela was there, and yeah, and she told us that we mustn't worry. Cullinan is like a 5-star hotel.
It's like a what?
5-star hotel.
So your brother's going to a 5-star hotel?
Yes.
Yes. And what else happened there on the day of the 11th of May 2016?
We pretty much sat there the whole day, and at the end of the day, they told us that he wasn't going to be moved on that day.
Okay, who are the we that you're referring to?
It was my mother, Joyce, Spiwe's mom, and myself.
And you waited there for him to be moved on that day? That is so.
It is so.
And when was he moved?
The following day.
Could you attend Waverley on the following day?
Yes, we did.
Who were the we that went the following day?
Again, my mother, Spiwe's mom, and myself.
And what happened there? This is now the 12th of May 2016. What happened there?
We got there were 3 buses, actually 2 buses and a vehicle. One of them was supposed to go to Cullinan and the other was supposed to go to Tshepong. The other one, I am not sure. They got into the bus, they were dressed warmly, they had shoes and jackets on. It was a cold day. And Daphne was there, the social worker from Cullinan. And
Daphne Ndlovu.
yes, Daphne
Yes.
Ndlovu. And we requested that we follow the bus to Cullinan so that Sizwe has an idea that we know what is happening and somehow everything will be okay. It was, in a way to calm him down and try to make sure that he doesn't relapse from the move.
And did you follow the bus?
Yes, we did.
And you came to CCRC?
Yes, we did.
And what did you find there?
What we found there was, when we got in, Sizwe was brought out with other patients, and he was admitted to CCRC, and we spoke to the matron, and she assured us that everything was going to be fine. She actually said that she also has a child who's disabled, so she understands.
And you believed her?
Yes, I did.
Did you see whether Sizwe had a medical file with him?
We did see a file, a blue cover file with his picture on it. That's how they were able to recognize who was who. Because some other patients, you might call their name and they might not respond.
Did you see the inside of this file at all?
I saw the first page of the file, and on that first page of the file, what I could see was the picture of the patient, and that was it.
Okay. You left Sizwe there.
Yes, we did.
Did you return at a later stage?
Yes, we did.
When was that?
10 days later.
I want you to please look at LR 24. This is a picture taken by you, is that correct?
That is correct.
And you've taken the picture on the 22nd of May 2016.
Correct.
And can you explain this picture to us, please?
It's a picture of Sizwe, sunburned, miserable, no humming. Humming was gone by then. When they brought him in, he wasn't wearing so many clothes. He had this yellow t-shirt on, that was it, and we had to send him back so that they can dress him warmly. It was a cold day.
You say that he was miserable. Why do you say that?
He looked miserable. He was dragging his feet. He had developed a tendency to sit with his legs on top of the chair folded, and he would hug himself. And he was very...
Just stop there. Just explain that motion again. You say you pull up your knees to your chest.
Yes.
Is that what you're saying?
Yes.
And then put your arms around your legs
Yes.
in a motion of keeping yourself tight.
Yes.
Why would that be?
My guess would be he was miserable, so he was trying to console himself, rocking himself.
And you said sunburn. Where do you know? Have you got any explanation for that?
He looked so dark in 10 days. 10 days later, he just looked so dark, and his skin was cracking.
And you say when you saw him, did he have shoes on?
He did not have shoes on. He did not have a jacket nor a jersey on. He had that yellow T-shirt on with a baggy track pants.
And because it was a cold day, you said he should be dressed more warm than that.
Yes, I did.
How was his general state further? Was he neat on himself? Was he unkempt?
Sorry to interrupt you. He was unkempt. He was smelly. He smelled as though he had dirtied himself, like he messed up on himself.
And did you do anything about that?
My mother took him to the bathroom and checked on him, and there was nothing. He looked like he hadn't taken a bath ever since he got there.
What did you do as a result of finding him in this way?
We complained.
To who did you complain?
We complained to the matron. We complained to the nurses.
And did you receive any explanation?
No, we did not.
Ms. Nkosi, as a result of finding him in this way, you wrote an open letter to the minister. Is that right?
That is correct.
It's attached to your affidavit LR 91. It's LA 91, and it's at the back of your affidavit.
Yes, I found it.
This is an email from you. Is that right?
Yes, it is.
And it says, forwarded conversation subject the open letter to the minister. Is that the heading?
Oh, yes, it is.
And
Yes.
it's from your email address. Is that right?
I can't seem to find the letter, but I know the letter, yes.
It's attached to LR 91. If you turn after your signature, you should find it. Do you
Thank
have
you.
it now?
Yes, I do have it. Thank
And
you.
the date of that open letter is 7 June 2016. Do you see that?
Yes, I do.
And to who is it sent?
It was sent to the Minister of Health, Aaron Mutwaledi,
And how did you get the email addresses?
Through the help of Section 27.
And you, in that email, you set out your findings at CCRC. Is that right?
Yes, I did.
Well, on the face of it, it doesn't seem to be directed to the minister. Who's HDBF and C2M? Are the people in the minister's office?
I would presume so, Justice.
As a result of this letter, you receive feedback. Is that so?
That is correct.
If you turn 2 pages,
Well, the answer is not complete. Why do you say you presume so?
I got the emails addressed with the help of Section 27. I did not have Aaron Mzwaledi's email address.
I see. Thank you.
could you turn to the last page of LR 91, please?
Mm-hmm.
2 days after you sending the email, you received, or this letter is signed by 2 people. Could you explain this letter to us? What is this?
This letter is a feedback from the email that I sent.
And from who is it?
It sends kind regards Manaka, JD, the manager of CCRC, and the CEO of CCRC at that point.
And the letterhead is the Gauteng Province Health, Cullinan Care and Rehabilitation Center. Do you agree?
I do agree.
And they list the items in your letter of complaints, and they say they'll get back to you. Is that right? Let us just go through the bullet points. What are they? Which complaints of yours are they acknowledging?
That my brother is dirty and is wearing misfitting clothes. That worn-out blankets for they sleep with worn-out blankets in winter. That they are allocated a very small environment to go and play outside. That we couldn't bring my brother something to eat because they didn't have lockers like they did at Waverley, so they were acknowledging that as well.
And that your brother was being beyond sad?
Yes, he was beyond sad. And that the visiting room was in an appalling condition.
You said a dirty table without chairs to sit on.
Yes.
In your letter, you also referred to a mattress on the bare floor.
Yes, I did.
But they haven't responded to this, to there being a mattress on the cold floor.
No, they did not.
What I don't get is in what form were your complaints to them, to CCRC officials? Did you write?
Yes, I did. I wrote that letter that
You wrote the open letter
the
to the
open letter
minister.
to the minister stating.
I see. So what we see here would be a rehash of what, or some of the issues you raised in the letter to the minister.
Yes.
I missed that. So you're saying to me, in effect, the letter from the CEO, the quality assurance manager at CCRC, was a response to the issues, to the open letter to the minister.
Yes, it was.
Okay, help me understand that. Let's look at your complaints. Where do they start? In the letter to the minister. It might be the last paragraph, is it? In 10 days after being relocated from Waverley, my brother looks and smells as though he hadn't taken a bath ever since he arrived at Cullinan. He was wearing old, dirty clothes, misfitting clothes. He was shaking and inquired with the caregivers as to why he was shaking. There was no response. There are not enough blankets. On the beds they sleep on. And the one blanket they have is too light and worn out to sustain them throughout the night. Small sponge on the floor used as a mattress for a patient to sleep on. And they leave patients on the cold concrete floor, lying around. They are allocated a very small space in an open environment, like animals in the zoo. Caesar is beyond sad, it's devastating. Nothing was done to prepare my brother pertaining this, I say. So the bullet points summarized in that letter were in response to that paragraph.
Yes, Justice.
I follow. Do you know how your letter to the minister reached CCRC?
I do not know how it reached the CRC, but I also received a call from the matron saying that she cannot help me with Susie being over 100 kilometers away from us. The rest she will try.
Council.
Thank you, Ms. Nkosi. The question that you answered now was actually, did you receive any response after this letter?
Yes.
Isn't that so?
Yes, I did.
And your answer to have you received any response to CCRC's letter is that the matron phoned you.
Yes.
And what did she say to you?
She said she would try with everything else, but she cannot help me with Susie being over 100 kilometers away from us going to Cullinan.
And where was your home at the time?
Soweto, Zola North.
Now, after this letter to the minister and receiving a letter back from CCRC, did things go better at CCRC?
No, they did not.
What happened?
He kept on losing weight. He never got better. He kept on deteriorating.
Okay. We will come back to that now. Could I ask you, just to follow the timeline, LI 94. Do you have that in front of you?
Yes, I do.
Now, that is a memorandum to the Gauteng Department of Health from Families of Life Esidimeni users, and it's dated 9 June 2016. Do you see that?
Yes, I do.
What letter is that?
It's another memorandum. We're marching again to the Department of Health.
Where was to the Department of Health office? Where did you march?
To the Department of Health's office.
On the 9th of June 2016.
Yes.
And how many people approximately was marching?
This time it was better. I would say about 60.
About 60 people.
Yes.
And this memorandum, was it read out?
Yes, it was read out by Lesego.
By who?
Lesego.
Letsejo. And
But you marched from where to where?
She read the entire letter.
no, from where did you march?
Oh, we marched from Mary Fitzgerald Square to the department's office.
And when she read out the letter, was there any official of the department there?
Yes, they were.
Did anybody accept this memorandum?
Yes, it was accepted and signed.
And do you know who accepted and signed it?
I'm not quite sure because at that point I didn't know them by name, so I would have to guess and say it was Dr. Silebano. It was a male. It was a male person.
It was
For
a
sure.
male person.
Yes.
And your complaint in this letter in the first paragraph, you say that the department has been moving loved ones. Is that so?
Yes, it is so.
And you were complaining that that happened without alerting the families and that the families had to track them down.
Correct?
Is that information that you've received?
Yes.
Now, the second paragraph says that we have made extensive efforts to engage the department. Is that so? Did you do that?
Yes, we did do that.
It says the department has treated us with indifference and indignity. Did you feel that way?
We did feel that way.
Why?
Because as much as they said that they would move patients by June, they would be very careful with patients and they would try and do it in a humane manner this time around. But that was not the case. We would ask the staff, we would ask the security, I would pretty much ask everybody that I could ask at the time, and they would tell us that patients are being moved. So they were lying.
And you also say in that paragraph, it has failed to put in place a plan to protect the rights and safety of our loved ones. Did you believe that?
Yes, I did. I still do.
And then you say many of our loved ones are relapsing and dying as a result. Was
Yes.
that information that you had?
Yes, that was the information that I had.
And then you say we demand change. And then you've got bullet points. Is that right?
Yes.
And then if you turn the page, there's demands that must be seen to. And you demanded a response by 15 June 2016. Is that right?
It is right.
And
But
this
what did they say to these demands? This is June 2016. In fact, this March was a day after the letter from the CEO of CCRC, isn't it?
Yes.
If I look at the paperwork, their letter was a day before the 9th of June. It was on the 8th of June. So you had been to CCRC, you
Yes.
had seen your brother, you knew there was trouble coming, and you write this. What did they say to this? You want the profile of each NGO, where family members have been and will be placed, accreditation documents of each NGO, and their readiness to provide appropriate care and treatment, details of the funding of NGOs, department's plans for supporting, monitoring, and evaluating the NGOs, proper individual consultation between the department and the relevant family, each family to be provided with assessment conducted of their loved ones, a toll-free number that family members can call to establish where patients have been placed. Was there any comeback on this?
Justice, maybe I could help with that.
You're going to get us there?
Yes.
Okay.
If you could just move to the next document, please, Ms.
It just
Nicholson.
startles me that it is so on point,
Yes.
and it was clear even then in June 2016. Very well.
Can you go to LR 97? LR 97?
I am there.
Now, this is a document that has the name Dr. Malamela and a date 15 June 2016 at the bottom of page 8. Do you see that?
Yes, I do.
And 15 June was the date that you've given the department to reply to your demands in the March. Is that right?
That is right.
Now, let us just go to the front of that document, LR 97. It has the Gauteng Province Health logo at the top of the page. Is that right?
It is right.
And it subject is memorandum submitted by family members of the mental health care users admitted in Life Esidimeni facilities. Is that right?
That is right.
And it says that the purposes of this document is to respond to your demands. It says this. I'm not saying they responded to your demands. I'm just saying that this is the purpose for which they've written this. Would you agree?
I would agree.
If we, then there's a background information to the contract. If you turn the page, just before the memorandum, do you see on page 2, the last paragraph just before the heading, the memorandum, towards the bottom of the page?
Yes, I do.
It says, regardless of the efforts by the department, some of the families and other stakeholders presented with dissatisfaction of the ending of the contract relationship and took the department to the media, court, and also toyed and sent memorandums. Do you see that?
I do see that.
What do you
On
think
which
of?
page?
It's page
Of
2.
L97, is it?
It's page 2. Justice is just the second last page, paragraph on page 2, just
Okay.
before the heading, the memorandum.
I've got it now, thank you.
What do you say to that? What do you say that speaks to the attitude with which you were received?
We did toy, we did take our matters to the media. All that they are saying, it is true, and we had our reasons for doing that.
But it says that some of the family holders and stakeholders, it creates the impression that you were on a frolic of your own. Do you agree with that?
Explain frolic.
You were just being against the department. That is what this letter creates. Well, I will argue that.
Yes, it does create that impression.
Then it goes to the concerns raised by yourselves.
Page?
We're now on page 3 with the first concern. It says moving patients without alerting the families. And it seems to me that Dr. Malamela is wanting you to find out from Life Esidimeni where your families were moved from.
Yes, because they couldn't tell us where the families were moved from.
So the department is not taking responsibility.
Yes, they are not.
But it says that they will try to work with you. The next one is that the heading, their loved ones have been at Life Esidimeni for a long time. And the answer in the middle of that page, of that paragraph, Dr. Malamela says, the department paid for all users in Life Esidimeni, and the department noted that the services are no longer affordable and opted to a better, manageable resources at an affordable cost. Did you agree with that?
I do not agree with that. Still do not agree with it.
Then the next heading deals with family claim to have made extensive effort to engage the department, but treated with indifference and indignity. And it seems to me that she's saying, yes, you had engaged with them. The next heading, the department repeatedly lied to the families. The department denies lying to you. The next heading, at the bottom of page 3, says the department operated in secret. That was your complaint. And the answer to that is that the Life Esidimeni contract termination plans were shared in family meetings and also copied and forwarded to the committees. So they're denying that there was any secrecy. What was your feeling towards that?
There was secrecy. I still feel that even in this very day, there still is secrecy, Justice.
Why do you say so?
Because they did not share information with us. We'd find out from the nurses, from the security guards who were scared at that point to share information with us that patients were being moved.
The next heading speaks to the department failed to put the plan to protect the rights of their loved ones, and they just say they share the plan with you. Then the next heading, do you want to say anything on that?
I don't recall seeing any plan.
Yes. The next heading is that many of the loved ones are relapsing, and the answer to that is they've got no such information, and they would welcome such information. Did you engage, as a family committee, did you engage the department with complaints?
We did engage the department with the complaints.
Did Dr. Malamela know about those complaints?
She knew about the complaints.
So is this paragraph true?
It is very true.
Is it true that they engaged you? And that they're not aware of the information that people were relapsing?
We did have meetings. But the thing is, on those meetings, we would agree about something, then the next thing you hear on the media that something is being done.
Well, they basically say that the response there, look at it, is we don't know that any of the patients have relapsed. And if you know, you can share that with the department. You're welcome to contact the department if you know families that have relapsed. I mean, sort of patients that have relapsed. Anyway.
Thank you, Justice. You said you have shared the relapses as a family committee.
Mainly Sizwe Nkosi, yes.
And the next paragraph goes to your...
But by then, you had written your letter and they had responded, and that they're investigating the issues you're raising.
Yes.
And she, Dr. Manamela, writes that we know nothing about it.
Yes.
So I just want to make sure, and my question to you, was Dr. Malamela telling the truth here or not?
No, she was not telling the truth.
Yes. Now, if we go to the next paragraph, it says many of their loved ones are dying. That was your complaint. And her response is the department is trying its best to look after the patients. We have no death reports except the only 2 out of 1442 patients placed. These 2 were sick and on chronic general illness treatment. Then she says 1 death is 1 too many and cannot be taken lightly. But her response is, these were sick people. That's why they died. Will you agree with that?
I do not agree with that.
Then she deals with under bullet 1, the promise to be placed.
But before you go to bullet 1, we know now how many people had died by June 2016, isn't it?
Yes, Justice.
You write to her and say, patients are dying. She says, well, I know of only 2, and those were ill.
That is true, Justice.
Isn't it quite startling? Because the numbers show that, and we can look at it, I mean, I don't have it at hand, but it was easily around between 60 and 70 patients, if you added them up at that time.
Yes, Justice.
And she says, no, I know of only 2, and she is head of this project.
That is correct, Justice.
Anyway, you go ahead.
Thank you, Justice. We go to bullet 1, promise to place loved ones nearer to their homes. And she says, well, this has been honored except where there were no families and where there are not appropriate services closer. And then...
Is that true?
My
You
brother,
were there, you're available, you drove behind the bus to Cullinan, and your brother was still taken to a place 100 kilometers away from Zola in Soweto.
that is correct, Justice.
So this is patently untrue, isn't it, in your case?
It is, Justice.
counsel.
Then your next, the next bullet point there was users are moved without the family giving their choice on where they should go. And the answer there is the placement plan's emphasis that before their mental health care users are placed, the families must be informed of the place by the social workers from Life Esidimeni facilities. And when they're received at the NGOs in the hospital, the families are informed by the department or the NGOs. Now, you complained that you weren't consulted, you weren't given a choice where they should go, and she says, but you were told. What do you say to that?
We were not given a choice, yes. As to being told, we were not told by the department. The department only addressed us on the 29th of January 2016.
Okay, at the bottom of page 4 is a heading. It says, when questioned on placement, the family claimed to be threatened by either taking their loved one and care for them. That was one of your complaints. You weren't allowed to question the placement.
That is correct.
And her response is the department's priority is to place all mental care health users either in hospital or NGOs if the family cannot take them. And then she speaks to a survey that they've done. That wasn't really an answer to your complaint, was it?
No, it was not.
But she also says that no family was forced to take patients. Is that true?
I wouldn't say that.
Well,
wouldn't
there's
say so.
59 people missing. So we would want to know what happened to them. If their families wasn't forced to take them, where are they?
I don't know where the patients are. I really don't know. The thing is, if I may,
Yes.
we were told that if you're not happy with the place that they're taking your loved one to, you're more than welcome to take your loved one.
Yeah, it essentially is what? We're going to do it this way. If you don't like it, get out of here.
Correct, Justice.
Take him or her, and you're going to look after him or her yourself.
Exactly, Justice.
And that speaks to the attitude of the department. Do you agree?
I do.
Page 5, the next heading is your claim that the NGOs are not safe, medically sound, and or even possible for them to take care of their loved ones as they are not qualified. You felt this way as family members.
We did.
Now, Dr. Malamela's claim is all the NGOs are assessed and accredited before they can place and receive any mental health care unit. Now, we know that wasn't true.
Correct.
The NGOs that does not meet the requirements are disqualified. The NGOs that received mental health care users have met the specific requirements as on the audit form. We haven't seen the audit forms at all. Have you seen audit forms before mental care health users were sent to NGOs?
No, I have not.
Was it ever discussed with you that there were such forms?
No, there was no such discussion.
Then you complained in bullet 2 that the department is not telling family where the loved ones are going, and many spend weeks not knowing where the department took their loved ones, despite the best effort. A number of us still not know. The department simply is not available to engage us, even when they claim in the media they are doing so. That was your complaint, is that right?
That is right. It was our complaint.
And the answer to that is the department has been meeting with the family committee representing the family. The department has a procedure to be followed when transferring the users, which also has a, I don't know what that means, has a portion to inform the families. Is that an answer at all to your complaint?
To me, no, it's not an answer.
Did family members complain that they were looking for the mental health care users?
Yes, they did.
You see, Dr. Mandamela, insisted that Life Esidimeni should have done this. Dr. Khala comes to us and says, they never gave us lists of NGOs. So we just did not know where the people had been taken to.
Yes,
What do you want to say about that?
It is
Did Life Esidimeni know where people have been taken to? In your experience as you engaged with this tragic event?
It is really painful, Justice, because at some point they claimed that their phones were not working. That's why they were not able to communicate with the families. Today we don't know where so many of our loved ones are. And it is hurtful because the families spend so much money running around trying to find their loved ones, and honestly, they don't know where they are. We don't know where they are. We have tried, we're still trying, and it is difficult.
But did you understand the situation to be that Life Esidimeni are the ones who knew where your loved ones were to be taken to?
I understand.
Or were they rather fetched from there in buses and a variety of vehicles?
I understand when they say Life Esidimeni should know because they cared for the patients, and initially when you hand over somebody, I would think you would want to know where they're going as an organization. And the second one is?
Well, we know on that point, Dr. Khala says they demanded lists of NGOs and they were never given to them.
No, we were never given a list of NGOs. Instead, it was Life Esidimeni who tried and put a list of NGOs for us to go and check around, because at that point, we didn't know what was going to happen. So they're the ones who tried and put a list of NGOs for us to go and check where we can take our loved ones to. At that point, the department hadn't communicated with us anything.
Council?
Under bullet 3, you say your complaint is that the department said they wouldn't close the facilities before the end of June 2016, but Waverley was closed at the end of May and Randfontein on the 15th of June without consultation. And Dr. Malamela's answer is that Life Esidimeni was experiencing challenges in keeping the services open. I suppose that, and let me not suppose, and they then asked that the 68 mental care health users would be transferred to Randfontein complex, and Randfontein will continue until the 30th of June 2016. Was that an answer to your complaint?
This was not satisfactory to my complaint.
Why?
Because we agreed that there should be a humane, lawful way to move patients. We even asked how do they plan on preparing the patients about the move so that they don't relapse, to reduce the capacity of, yes, the stress and the capacity of them relapsing. And actually on that we were told that we must prepare them ourselves. So this was a disappointment because we did not agree to this, and this happened.
Now, the last bullet, the last heading on page 5 says the department promised the new facilities will be the same or better than Life Esidimeni, but did not keep its promise. Was that your complaint?
Yes, it was my complaint.
The answer to that is it's indeed the priority of the department to provide the appropriate services of high quality to all mental health care users. Therefore, all NGOs were to be assessed by a team of mental health services, including psychiatrists and engineers for infrastructure. The engineers, psychiatrists, and other multidisciplinary team members evaluated the NGOs before the placement. And then she says many of, so she said, no, that's not true, we evaluated. And then your complaint was many of the facilities do not have medications and is unable to access their critical health medication. Was that a complaint of yours?
It was a complaint of ours.
And her response is, well, they're collecting it from the district clinics and there's no shortages reported. Was that the truth?
No, it was not the truth.
Then your other complaint was NGOs, unlike Life Esidimeni, do not provide clothing to patients. And we provide, but is stolen. Our loved ones are cold in strange places. Was that a complaint?
Yes, it was our complaint.
Dr.
Well,
Melas,
that's a poetic line. Our loved ones are cold in strange places. It expresses pain, but it sounds like poetry.
I cannot dispute that.
Dr. Mela's response was, it is heartbreaking that Life Esidimeni did not issue the mental health care users with clothing they were using, even when advised to do so, and sent most mental health care users without the necessary attire. What's your response to that?
The patients, the ones that I saw when I was there observing when I could, literally got into buses with the clothes that they had on, shoes, jackets, that was it.
Most NGOs brought new clothes and shoes for the patients who did not have their own clothes. Did you see any evidence of that?
Anchor, for instance, we got there and, the answer to that is yes.
Anchor bought clothing.
No, they did not buy clothing. I had your question wrong. We had to buy clothing because they did not have clothing. We had to donate clothing because they did not have clothing.
And then Dr. Malamela's next sentence is, most of these patients were also wearing their own clothes at Life Esidimeni, as this was allowed. She continues, NGOs are also allowing family members to supply mental health care users with clothes if they can. The NGOs has to resemble homely environment than institutions. It's not really an answer to your question. Do you agree?
I do agree. It's not really an answer.
The next heading is that the NGOs didn't provide activities in stimulating the patients. That was a complaint of yours.
Yes.
And the surprising answer of Dr. Malamela is all NGOs were advised to develop rehabilitation programs within 2 weeks of receiving the mental care health users. So there was nothing at the NGOs. And then she says, however, physical exercises are done every day. Did you find any evidence of that?
No.
Then there was your complaint was that the NGOs demanded payment from families. Was that true?
I cannot comment on this one because I did not encounter an NGO whereby they demanded payment from the families personally.
Yes. But the
But-
families complained to the family committee about that. Is that so?
Yes.
If one turn the page to page 7, the heading at the top of that page says the department promised to divide a list of NGOs together with the process it used to approve. We do not know where our families are going and the criteria and the process. That was a complaint.
Yes, it was.
Now, Dr. Melamela says, well, they can't do this because the documents will be confidential. Is that the response that you got?
Still getting.
And then she goes through your list of demands, which I'm not going to work through. So all in all, you asked for, at your second march, you asked for some feedback, and would I be correct to say that you didn't receive satisfactory feedback at all?
You are 100% correct.
Now, we're just following the timeline still. If one go to LR 25, if you could go there, please. LR 25, do you have that?
I do have it.
Now, this is a few days after Dr. Malamela's letter to you, or your response. What does LR 25 depict?
It's a picture of my brother.
And what's happening on the picture?
My mother is cutting his nails off. He has lost a lot of weight. He pretty much looks like a skeleton walking. At that point, he had completely drawn, he had relapsed, and he wasn't humming, we weren't even getting eye contact. It was bad. It was really bad.
What
Well,
did you...
the picture says it, doesn't it?
Yes, it does.
You just need to look at LR 23, look at 24. 24 still tolerable, but 25. It's just unbelievable that it's the same person.
Where was this taken?
It was taken at Cullinan.
And did you complain?
Yes, I did.
To who did you complain?
At this point, I had to go and see the CEO, Miss Matilda Malaza.
And what happened in that conversation?
She couldn't even give me an opportunity to speak, to explain why I was there, to complain why I was complaining. She said she didn't see anything wrong with Usizwe, and she said the only thing that she could do for us was to weigh him.
To weigh him?
Yes.
And how would that help?
I don't know.
Did you ask her?
I told her that since you're not willing to do anything about the situation, we are going to weigh him together. May I please have some of her staff members weigh him in front of me to make sure that his weight does improve. And there was a mission.
To get you to weigh him?
Yes.
Did she offer any further services than weighing?
No.
And would weighing have helped him?
Not that I know of. No.
Did you complain about the quality of the food?
I did complain about the quality of the food.
And?
She assured me that they were eating plenty food. They were eating more than enough. They were eating all the time.
Now, Sizwe stayed there until after the Ombuds report came out. Is that right? When was he moved out of CCRC?
April this year, 2017.
And after the taking of that photograph until April this year, did things go better or did it go worse?
They continued to deteriorate.
And you continue to complain.
Yes.
And where is he now?
He's at Waverley in Jamestown, where he was originally.
And how do you find his condition now?
He's improving. He's
Is-
getting better. Yes, he's
Where's
getting
the
better.
picture? I want to see his picture now.
Now, it's on my phone, Justice.
Huh?
It's on my phone.
It's on your phone.
Yes.
Yes, you must print it and give it to council.
I will.
Because he really looks so emaciated. You can
Yes.
hardly see his eyeballs. They've
Yes.
sunk. If you look at the picture, have you seen? Of course you've seen it. You can hardly
Many
see
times.
the eyeballs.
I've seen him, not the picture, Justice.
Okay, you've seen the real thing. You're really saying to me, okay. But it's frightening. It's frightening. He's almost on the verge of losing his life. I mean, he's very thin,
Yes, Justice.
all bones, and you contrast that with the two pictures where you can see his eyes. He had white, bright eyes, brown obviously in the center and with the white background. But you can hardly see that, all gone.
Yes.
Well, you must give that to your council. I'd like to see the picture now.
I will give her.
Yeah,
I'll give her the
sure.
picture.
Ms. Nkosi, has he gained weight?
He is picking up weight.
Has he started humming again?
He is humming again.
Okay. So the stress on your family is a little bit less now.
Yes.
I'm going to speak to you about the effect that this had on your family. Let's start with your mother. What effect did this whole move have on her?
She got sick. She is still getting sick. She complains of pains in her body. She goes to the doctors a lot and she misses work.
How old is she now? Do you know?
She is 55 years old. June, next year, June. She's turning 55 years old.
And mentally, the effect that had on her?
She couldn't concentrate at work. She still misses a lot of she still uyalova emsebenzini, like a lot.
Uyalova emsebenzini. Elova ngoba egula.
Yes.
Well, somebody must interpret that for your counsel. She misses work a lot.
Yes.
She often stays home because of her unwellness.
Your sister?
My sister is not, especially last year, she was not doing well at school.
Academic achievement went down.
Yes.
And Mr. Kosi, yourself, what is your occupation?
I am a makeup artist for film production. I'm a freelancer.
And how do you get your work?
Through word of mouth, I get called in.
People have your cell number and they call you when they need you.
Yes.
And what effect did your involvement in the Life Esidimeni marathon project, or the Gauteng marathon project, what effect did this have on your business?
Well, it's non-existent now.
Why is that?
Because I became inconsistent. They would call me and I wouldn't be able to go to work because I had to choose between certain meetings that I had to attend, certain marches that I had to convene, certain things that had to do with Sizwe's well-being that took priority at the time. So I was unavailable, which made me inconsistent, which I lost a lot of clients due to that.
And what's left of your business now?
It's non-existent.
Emotionally, how did this affect you?
I would say really, really bad. I'm not what I used to be.
As a family, did you express your sadness to each other?
Yes, we did. We still do.
I'm going to ask you about what specific contact you had with specific people in the department. If I could start with the MEC,
The former MEC.
the former MEC. You met her at the march, the first march, is that right?
No, we met her on the 29th of January 2016 when she came to Waverley to address the families finally.
That was before the first march.
Yes, it was.
And
I think it
what?
was at the same late meeting.
Yes.
And what did she say at this meeting?
She promised us that everything was going to be okay. She told us that at the end of the day, she doesn't have a mentally ill patient in her bloodline. These were our loved ones, so we had to take care of them. We asked what measures were put in place to make sure that our loved ones do not relapse. She told us that we had to make sure that they do not relapse. We must talk to them or something. We must do something.
And the next meeting you had with the MEC after the January meeting?
It was after the march. I can't quite recall the dates.
And what happened at that meeting?
What I can tell you, Justice, is that through these meetings, we would discuss something and only to find that what we agreed upon would not manifest and would hear something else through the media or through the staff that was working at Life Esidimeni at the time.
Did you also attend a meeting where Section 27 SADC and Dr. Tala was with the MEC in October 2016?
Yes, I did.
What happened at that meeting?
Honestly, I can't tell you because she was the one who spoke and
She, MEC Mahlangu,
the former MEC Mahlangu, yes. And to be honest with you, Justice, I don't recall anything that she was saying at the time.
Did you experience this as a sympathetic person or not?
There was no sympathy, none whatsoever, Justice.
and did SADC at that meeting make their point that this project is likely to be unsuccessful? It might endanger lives of patients who are dependent on mental health care.
Yes, SADC, Section 27, SASOP, South African Health Federation, yes, they did.
And what did the MEC say?
She assured us that everything was going to be fine. They were on top of things.
But she also told you that the project was going to continue, did she?
Yes.
In other words, the placement project, the marathon project, was going to go on and it will all be fine. Is that what she said?
Yes, Justice.
Can we, Ms. Nkosi, move on to your contact with Dr. Malamela?
Come again?
Can we move on to your contact that you had with Dr. Malamela?
Yes, we may.
Could you explain what happened in the meeting in the first week of February, second week of, in February 2016? Why did you go to her office?
I went to her office to let her know that we will be coming to her to March to hand over a memorandum and a petition to her office. And she called me up to the offices, as she mentioned here whose office it was, Chief something, can't quite remember. I found her in a meeting with her superior, and her superior stated that Dr. Manamela at the time was busy updating her on the marathon project. And I stated why I was there.
Who was the superior?
It started with Chief. It was Chief something, I'm not sure. It was a lady, black lady, short hair, short, dark.
Okay.
Yes,
A bit more poetry, but that's fine.
can't help it. Sorry.
We don't know her name.
No, she didn't give me her name.
Okay.
Yes. And I stated why I was there, and we talked a bit about the marathon project, and she admitted that her plan was that by the end of March they should be done relocating the patients. We also spoke about the funds. I asked her a question because at the time I was conducting my own research. I knew that the nurse at Takalani cost more than a nurse at Waverley. And I asked her as to how was she planning on saving funds. She completely lost it. She lost her temper. She told me I better stop what I was doing or else. Then the chief woman called her into order.
Yes. She denied it. You heard her deny that.
Yes, I did.
What do you think triggered her anger?
I think it was me touching on how exactly were they planning to save money, because save money and provide the same level of care that was expected as the patients received at Waverley. And I did not understand because the nurses at Takalani cost way more, like around about 13 to 15 rands an hour, and the one at Waverley cost around about 4 rands an hour. So it was a huge difference, and I couldn't comprehend as to how exactly were they planning on saving funds.
And how did she express her anger? We couldn't ask her that. She denied. She said no, it didn't happen. She didn't get angry.
Wangithethisa ukuthi
Ethethisa ukuthini?
ukuthi kahle kahle yini inkinga yami, ngifunani lana, what am I doing here, and I better stop what I'm doing or else.
She was shouting at me, talking to me strongly, saying, stop what you're doing or else. I might have to get an interpreter's fee at the end of all this.
Thank you, Justice. Justice, I see it's very close to tea time. I've got about 10 minutes or so left for this witness, or maybe a little bit less.
I think you keep rolling to
Thank
the
you.
end, I think.
Thank you, Justice. Ms. Nkosi, there was a third march as well.
Yes, I convened that one as well.
Please turn to LR 95. It's LR 95.
There's LR 9. Oh, here it is. Okay,
Have you got
found it.
LR 95?
Yes.
It is headed Life Esidimeni Families Demand Action and Accountability. Do you see that?
Yes, I do.
And there are, it's 2 pages. Is this the document that was handed over on the 3rd March?
Yes, it was read by Christine.
It was read by Christine.
Yes.
And that was on the 27th of October 2016.
Yes,
Is that right?
it is correct.
It was read out. From where did you march, firstly?
From, again, Mary Fitzgerald Square to the Department of Health offices.
And how many people were there this time?
The turnout was great. It was great. People came through. We had a lot of support from a whole lot of people and stakeholders. Yeah, I cannot place a number. It was a lot of people.
Now, there are two quotes, one from the Bible and one from the Quran. Thank you. And underneath it says, Johannesburg, 27 October 2016. We are here today because at least 38 people, 38, and in all likelihood many more of our cherished loved ones are dead. Thousands more are in danger. Was that the reason for the march?
Yes, it was the reason for the march.
And if we go down just a few paragraphs, the shortest paragraphs, it says the department ignored our warnings and continues to do so. People died and continue to suffer as a result. Is that how you felt?
Yes, it's how we felt.
And then you made demands.
Yes, we did.
And that's how it was, wasn't it?
Yes.
But then, October 2016, many mental health care users had died.
Yes, Justice.
Now, you ask in paragraph 7 on page 2 of 2 that you want a written response by the 3rd of November 2016.
Yes.
Now, just to put this into perspective, at this stage, the Ombud was already busy with the investigation. Is that true?
Yes, it is true.
Are you aware of any response that you've received?
No, because I know we asked for the list. Till this very day, we're still asking for the list. We asked for the regulating guidelines as to how were they assessing and licensing their NGOs. We never received that. No, not that I know of.
Okay. One of the things that you demanded in paragraph 1 is that the department and the former MEC accept responsibility for these deaths. Has that happened up to this stage?
No.
And you already spoke to the plan that you wanted. You didn't march after that day again.
No, we did not. We
Why
had
is
3
that?
marches. Because we were waiting for the Ombudsman's report to come out, then we were going to take it from there.
Yes. I'm going to speak to you about redress and closure, but before I do so, Justice has
I
asked...
think we should adjourn.
Yes.
I realize now those are weighty things, and in any event, we're going to have to hear your other colleagues and hear
Yes. Thank you, Justice.
Ms. Nompumelelo Nkosi in the end, in any event.
Nompilo.
So, Nompilo, what did I say?
Nompumelelo.
Nompumelelo, Nompilo. Nompilo. Okay. I've just been roughed up there for saying Nompumelelo. The name is Nompilo. I think we're going to adjourn now, shouldn't we? Because I think there is a bit of a way to go before we bring closure to this part of the evidence. Shall we adjourn now till midday?
Thank you, Justice.